I'm excited to introduce a very powerful and increasingly popular therapeutic approach called acceptance and commitment therapy, or ACT for short. ACT is designed to help people live more meaningful and value-driven lives, despite the presence of difficult thoughts, feelings, or memories. Instead of trying to get rid of emotional pain, which can likely be impossible or counterproductive, ACT helps clients change their relationship with that pain. The ultimate goal is psychological flexibility, meaning learning to stay present, open to experiences, and willing to take action that aligns with the client's personal values. ACT was developed in the 1980s by psychologist Stephen C. Hayes. It is grounded in relational frame theory, a behavioral theory that explains how language and cognition shape our experiences. Unlike traditional therapies that focus on reducing symptoms, ACT helps clients build meaningful lives by shifting how they respond to internal experiences like anxiety, grief, or self-criticism. Rather than eliminating these difficult thoughts and feelings, ACT promotes acceptance and mindfulness, empowering clients to respond in ways that align with their values and goals. The foundation of ACT is the Hexaflex model, which includes 6 core processes working together to build psychological flexibility. Clients build meaningful lives by shifting their response to anxiety, grief, and self-criticism.
In order to understand the Hexaflex model, we must first understand the cycle of psychological instability. There is a crucial difference between pursuing happiness and avoiding pain. Experiential avoidance is when we try to evade uncomfortable thoughts or feelings. While such behavior may feel better in the moment, it often leads to procrastination, disconnection, and isolation. In response to this disconnection, our thoughts begin to tighten their grip. Cognitive fusion occurs when we treat our thoughts as facts. Avoiding a social event for fear we'll say something foolish not only reinforces loneliness, it also gives that thought more power. As fused thoughts repeat and solidify, we slip into a state of mental fixedness. Here, we become stuck in rumination, replaying past mistakes or worrying about scenarios which may never occur. Over time, these patterns begin to shape how we see ourselves. This leads to a self-as-content mindset, where we begin to internalize feelings of anxiousness, incompetence, brokenness, or unlovability as defining aspects of our character. As cognitive fusion shapes our sense of self, our connection to our values weakens. Though these guiding principles still exist deep within, they often feel out of reach, overshadowed by self-judgment and avoidance. Without the grounding influence of our values, inaction and impulsivity tend to take over. Lacking a clear sense of direction, we may feel stuck, frozen by indecision, chasing momentary relief, or slipping into avoidance instead of moving toward what truly matters. The Hexaflex model is a core framework of acceptance and commitment therapy, developed to interrupt cycles of psychological inflexibility and to support a more open, value-driven way of living, even in the presence of emotional discomfort. ACT's 6 core processes, reflected in its name, are organized into 3 distinct functional response styles. These, in turn, are supported by 2 foundational pillars: commitment and behavioral activation, and mindfulness and acceptance. Mindfulness and acceptance cultivate openness and support engagement by helping us make space for difficult experiences instead of attempting to suppress or escape them. Commitment and behavioral activation promote awareness and strengthen engagement by encouraging value-aligned growth, even during moments of psychological distress. Engagement is the point of intersection between openness and awareness. It is defined by a willingness to stay present and to act in alignment with one's values. Engagement isn't just about taking action, but doing so with clarity, direction, and intention. It is within the principles of openness, engagement, and awareness that the 6 psychological processes of the Hexaflex model take form. Openness refers to allowing thoughts, emotions, and physical sensations to exist without resistance. Core principles of openness include acceptance and cognitive diffusion. Acceptance involves willingly making space for discomfort rather than engaging in avoidance or suppression. Cognitive diffusion helps us observe our thoughts with perspective, not as facts to obey, but as experiences to notice and let pass. Engagement propels us toward meaningful action, not because it is easy, but because it aligns with our most deeply held values. Core principles of engagement include present moment awareness and self as context. Present moment awareness enables us to remain grounded in the here and now, rather than being consumed by memories or imagined outcomes. Self as context refers to the stable observing self, the part of us that is aware of thoughts and feelings, but not defined by them. Awareness encourages broader perspective and fosters mindful, non-judgmental contact with experience. Core principles of awareness include values and committed action. Values clarify what is personally meaningful, answering questions such as, who do I want to be and what do I stand for? Committed action refers to taking purposeful steps in service of those values, even when the path forward is uncertain or emotionally demanding. Together, the dynamic interaction between the Hexaflex model's 6 core processes helps us replace avoidance and entanglement with openness, presence, and intentional behavior, all in service of more meaningful, value-driven lives.
ACT offers a fresh perspective by recognizing suffering as a natural part of being human, one that doesn't prevent us from living meaningful lives. Rather than treating discomfort as a problem that needs to be solved, it is seen as an opportunity for growth. What really makes ACT unique is how it honors the full range of human experience. The first half of ACT's foundation, mindfulness and acceptance techniques, are perfect for addressing a wide range of concerns, including anxiety, depression, chronic pain, and substance use. Whether overwhelmed by emotion or caught in patterns of avoidance, the second half of ACT's foundation, commitment and behavioral activation process, can be deeply empowering for clients who feel stuck in unfulfilling narratives. At its core, ACT helps people accept what they can't control and to commit to what truly matters. It's an active, values-based approach that encourages people to move forward even in the presence of fear, doubt, or uncertainty. In this segment from Indiana Jones and the Last Crusade, the famed archaeologist must cross a bottomless chasm in order to recover the Holy Grail and save his dying father. A riddle suggests that only a leap of faith will allow him to span the large divide. Initially, Indy believes such a leap to be impossible. He is not a man of faith, but this journey has taught him that he values his relationship with his father, which leads him to prioritize making the leap. As his father struggles to survive, he centers himself, staying in the present moment. Stepping out from the chasm's edge, he demonstrates cognitive diffusion, recognizing his fear without letting it control him, which opens the door to acceptance. He acts from a deeper part of himself, his self as context, one that holds fear, the doubt, and the meaning of his mission all at once. Trusting the message, Indy steps into what looks like empty air, expecting to fall, but instead landing safely on a camouflage bridge. Despite the uncertainty of his path, Indy's pursuit of his goal demonstrates committed action. The Leaves on a Stream meditation is a mindfulness exercise that invites a client to visualize their intrusive or reoccurring thoughts and place them on leaves that are quietly floating down a stream. It assists in helping others observe thoughts as passing events instead of actual facts, and to build psychological flexibility by encouraging these thoughts to come and go without judgment or attachment. This practice appeals to the acceptance, cognitive diffusion, present moment, and self-as context subdivisions of the openness and engagement principles found within the Hexaflex model. This half of the model focuses on mindfulness and acceptance practices.
Hey, Megan, welcome back. Where would you like to start today?
Hi. Well, I've been trying to work on a paper for one of my classes, but I've been getting really stuck. My anxiety just goes haywire. All these thoughts come flooding in about like how I'm stupid and can't do anything right, and I'm terrified of failing, and everyone thinking I'm incapable. I really want to do well in this class, and honestly, I think I can. But I can't even begin to focus on the work with all of this going on in my head.
Gotcha. It's a lot. Okay, so if I'm hearing you correctly, I'm sensing anxiety, having a difficult time separating from your thoughts.
Yeah.
Okay. All right, I'm wondering this week if you'd like to try something new. I've been thinking about your anxiety and just kind of like how to maybe help you recognize that we are not our thoughts. And this is a mindfulness exercise that does not require you to do anything or even talk, actually. It's just about listening to my prompts and kind of like letting your mind flow according to what I'm saying. But if you're willing to try, we can give it a shot.
Yeah, I'm honestly not sure it'll work because my thoughts are very persistent.
Hmm.
But no, I'm willing to try anything at this point.
All right, well, let's give it a try and we'll see how you feel at the end. So get yourself in a comfortable seated position. Allow your shoulders to drop down and relax. Get your feet kind of planted nice and firmly on the ground and just kind of find a nice and neutral position. And when you're ready, you can gently close your eyes. And for the next few breaths, just take the time to bring your full focus to the attention of your breathing. Notice the feeling of the air going in through your nostrils, down into your lungs, down into your belly as you inhale, and on the exhale, feel the release of any tension that you're holding on to as you let the air out slowly. Now, imagine that you are sitting by the side of a gently flowing stream. This might be a stream that you know, it might be something you create in your imagination. There might be a light breeze blowing, a dap of light glistening on the water, soft green grass beneath you. But imagine it's autumn and the trees at the edge of the stream are losing their leaves. As the leaves fall into the water, they just gently float by you on their way downstream. And for the next few minutes, let's try and take every thought that pops into your head and place them on a leaf. So some of your thoughts might show up in your mind in the form of words, pictures, or maybe even something else. But however a thought arises, simply place it on a leaf and let it float by. Do this again and again, regardless of whether the thoughts are positive or negative. Simply place each on a leaf, let it float downstream. And if you notice that your thoughts momentarily, just continue to watch the stream. Sooner or later, your thoughts will start to pop up again, and this is normal. If your mind says something along the lines of, I can't do it, or this is stupid, place those judgments on the leaves and let them float by. If a difficult feeling arises, such as boredom, impatience, anxiety, simply acknowledge those. Say to yourself, here is a feeling of boredom. Here is a feeling of impatience, or here's a feeling of anxiety, and place those words on a leaf. And so from time to time, your thoughts will hook you and you will lose track of this exercise. And this, again, is totally normal. As your attention might naturally wander, it'll happen from time to time. And as soon as you realize this has happened, simply come back to your stream without judgment or frustration and continue to place the thoughts on the leaves. Again and again. Thoughts will hook. Remember, this is normal. Try and unhook by placing them on the leaves and returning to your stream. And as the exercise comes to a close, begin to let go of your imagined stream and bring your attention back to where you really are. Notice what you can hear and feel when you're sitting there quietly. And when you're ready, gently open your eyes and notice what you can see. You might take another moment to sit quietly before carrying on with our session and see if you can hold on to that sense of calm and presence and spaciousness that you might have found throughout this exercise. What'd you notice?
That was surprisingly effective.
Okay.
It was hard at first, overwhelmed by my thoughts. But once I got the hang of the visualization, it was easier.
All right, great. What'd you visualize? How did it work? Were you seeing thoughts? Were you seeing words? Were you seeing colors? What was coming up?
Um, I think my thoughts just kind of turned into the leaves.
Mhm.
And I think picturing them as something physical really helped me let them go.
Yeah, it's great. Did you get hooked by the thoughts? Like if you were you able to unhook from them or just did you kind of get stuck in them and was it hard to get back to the stream?
Yeah, definitely. I mean, a few hooked on stronger than others, I would
Mhm.
say.
Yeah.
But I think like visualizing the leaves, the thought of like physically unhooking was really helpful.
Good, good. And did any negative or painful thoughts show up? And if so, were you able to place those on the leaves in the same way you were able to put the positive or neutral thoughts on them?
Yeah, honestly, once I got the hang of the visual of the leaves, my thoughts kind of like placed themselves on the stream and
Great.
automatically away.
All right,
Yeah.
awesome. Well, so how do you feel now? Do you feel any different? Was it helpful?
Um, yeah, no, it was definitely helpful. I still have some thoughts kind of floating around, but they're not like as strong as they were before. I feel a lot clearer and I'm not like overwhelmed by the thoughts. I think I might actually be able to get some work done.
That's great. I'm glad it was effective and most certainly is something that you can carry with you wherever you are. It's a quiet mindfulness exercise, so it's not a thing. You don't have to pack it with you. It's always with you. And you can do it for a brief moment. You can do it for a longer period of time. You can change the imagery or the visualization depending on what's coming up that day. But it's just a really helpful tool to get your heart rate down, to get your brain back online, particularly before studying or something like that, that you really have to be thinking and turned on. So yeah, there's lots of stuff like that with this acceptance and commitment therapy, but I thought that might be just a good one to start with. I'm glad it was helpful.
Yeah, thank you. That was great.
The verbal choice exercise helps clients practice recognizing stuck points and choosing values-based action, even in the presence of discomfort. This practice appeals to the values, committed action, present moment awareness, and self as context, subdivisions of the awareness and engagement principles found in the Hexaflex model. This half of the model focuses on commitment and behavioral action processes.
Okay, John. It's been a good session, I think. But as we wrap up, why don't we work through something called a verbal choice point exercise? Are you up for that?
Yes.
Basically, this is just kind of a way. I just have some questions for you. I want to run through them and see what we can do to lead to some committed action on your part. So let me start by asking you a question or two. Can we walk through a recent moment when you felt stuck or unsure of how to respond?
The new school routine has completely changed my schedule. I used to have time for exercise and now I don't, and I'm putting on weight and that's really frustrating. I enjoy eating and I was exercising enough where I could eat the things I want, and now I really can't do that.
Okay.
Um, and I'm so busy that there's kind of an absence of consistent or guaranteed pleasure at this point. And that's frustrating, especially considering how hard I'm working.
What was happening externally?
I'm putting on weight. My clothes are starting to feel uncomfortable. I'm busy with school and exercising less. Uh, Normally, food was the reward for a week's worth of exercise, but I'm no longer exercising, so I don't get to enjoy that reward. And I mean, it was difficult to keep up that exercise routine when I had time, and now with school, it's really difficult, and I can't keep up with my routine physically or schedule wise.
What were you feeling or thinking in that moment?
And it feels like there's just never going to be a solution to this problem. I'm just getting older. It's only getting more difficult. And if I can't meet my own standards, then what's the point of anything? And nothing is worth this level of aggravation. I just wish I could stop caring about all this.
Oh, that's a pretty strong word. I'm sorry. I'm sorry you feel that way. What? when you have these conflicts with school, like a conflict between school and the gym, right? But tell me a little bit more. What are you actually feeling or thinking in that moment when you are having those conflicts between um, getting to the gym and perhaps sticking with your academic duties or assignments? What are you feeling or thinking when those moments happen?
I feel aggravated. I'm not sure what's even driving me forward at this point. I just want to eat. I just want some pleasure.
Yeah, it can be. I would imagine it would seem frustrating when you're trying to do something better for yourself and it gets in the way of something else that you've already been doing that that's already been good for you, right? And it's a bit conflicting. That's kind of what I'm hearing there. Is that kind of what you're saying there?
Yeah.
If you were to move in the direction of something that matters to you, a value, what might that look like in that moment?
Can I be vain? I want to look good naked. I don't know how else to put it. I mean, I want to feel good about what I see in the mirror. If I'm putting in effort, I want to see the results of that effort. And I'm not seeing that anymore.
And again, John, that's not unusual, and nor is that something. It's not vanity. That's just part of the human condition. I wouldn't sort of dismiss it as being vain. That's something that all of us go through. And then, but when you try to get towards that, when you want to look good naked, as you put it, when you want to look better and feel good about yourself, what are the things that kind of get in the way of moving towards that sort of a goal or
If I
value?
eat, I don't like the way I look and I feel bad. And then it's not practical to starve. So I still feel bad. I still feel bad. There's there just doesn't seem like any decent option, unfortunately.
What thoughts, feelings, or urges tend to show up that make the value-based move harder?
I'm frustrated. It's not like, obviously drug addiction has its own complexities, but potentially I don't need to take drugs, but I do have to eat on a regular basis. So practically I can't get away from it. Um, I don't enjoy the healthy options that much. And I already cook for myself, but I'm not going to waste my time doing, something artisanal or things like that. It almost seems like the more creative I get, it's still just going to be unhealthy. Um, it just feels like my whole life is in service to something unattainable. I'm not enjoying the process at all.
And again, that's not. I don't think it's unreasonable, nor do I think it's unusual. I think many people feel though have the experience of those feelings. It makes sense that those reactions show up. They're justifiable, they're normal, and they're rational, right? But it's not. It's more about noticing them and then still choosing what matters. And what matters, and from what I understand, from what I'm hearing you say, what matters is maintaining those that your physical appearance and maintaining your health, and that matters to you. Is that right?
Yeah, but I'm angry. I want my work to equate to something. I'm tired of working so hard. I don't want to work harder.
It makes sense that those reactions show up, and it's not about getting rid of them. It's about noticing them and still noticing what matters. What's one small action you could take in the next 24 to 48 hours that moves you in the direction of that value?
Now, I guess exercising less, but committing to actually exercising, even if it ends up just being uh, a half hour or so, just doing it. And I guess trying not to beat myself up for what I've done. I certainly had days where I would do so much exercise and then not feel like I got anything out of it. But all I could tell myself is, well, you did the work for that day. You can't do any more work. It's not healthy. You have to come back, fight another day. So I need to kind of have that attitude that recognize the work I've done.
On a scale of 0 to 10, how willing do you feel to follow through on this?
I would say a 7 or an 8. I mean, I'm willing to commit to it.
Okay, John. Well, that sounds terrific. And listen, I'm going to invite you at this time, though, to commit to that with me.
Yeah.
And just tell me what you're committing to specifically and why you're committing to it. And then we can discuss next week about your success in following through with that commitment?
I commit to exercising less while also committing to exercise consistently because I care about the way I look. And I'm not going to beat myself up for the work I'm doing.
Okay, there you go. And I'll take that commitment. I'm going to write this down. And John, we are out of time. I'm looking forward to seeing you next week when you're going to come back and let me know how this goes.
Thanks a lot.
As a school counselor, I could definitely use acceptance and commitment therapy, ACT, to help students navigate difficult emotions and experiences without feeling overwhelmed by them. ACT teaches that instead of trying to eliminate uncomfortable thoughts or feelings, we can learn to notice and accept them while still moving forward towards what matters the most. For example, if a student feels frustrated or embarrassed after a conflict with a friend, I might guide them through a short mindfulness activity to notice those feelings without judgment. From there, we'd set small, achievable actions aligned with those values, even if the anxiety is still present. Acting helps students build psychological flexibility so they can engage in school life more fully, cope with challenges, and continue growing academically, socially, and emotionally.
I am of the mind that what we resist tends to persist. So the acceptance piece of ACT really resonates with me. I also really connect with the idea of that we have thoughts, but we are not our thoughts. And the unhooking idea from ACT, I think, is a very powerful image that can help manage negative self-talk and negative thoughts in general. So both of those aspects I could definitely see bringing into sessions with clients. Additionally, I have practiced mindfulness for years, and it has been incredibly helpful with anxiety and ADHD symptoms. So as long as a client was willing to give it a try, I would definitely also bring the mindfulness exercises into sessions.
I have ADHD, which makes practicing mindfulness pretty difficult at times. Uh, as a counselor, I wouldn't necessarily feel comfortable advocating for a practice that I can't employ myself. And I do think advocacy is key to the techniques that we use. The goal is to make this accessible. And in terms of ACT, it gets pretty convoluted after you get past the ideas of acceptance and commitment. Uh, with all that being said, my time with James was genuine, and it really did get me thinking about living a values-based life versus a task-based life. Right now, mine is very much task-based, but hopefully, as school goes on, I will find a deeper passion for what I'm doing, and that will change. So overall, I would definitely advocate for value-based living among my clients and myself, but I wouldn't necessarily employ the ACT method.
I'm very much drawn to existential gestalt and therapeutic theory, logotherapeutic theory. And when I got into ACT and started looking at the hexaflex model, I was really surprised at how beautifully that model will dovetail with these more esoteric, sometimes difficult to grasp theories. And it makes it accessible to the client, and it helps give the client a way to incorporate that into everyday living. That, I think, is really powerful stuff. Within the 6 steps or the 6 parts of the hexaflex, of course, you have things like present moment awareness, gestalt. You have living with meaning and purpose, logotherapeutic. You have being able to incorporate and live with uncomfortable emotion, uncomfortable experiences, and not make them part of your very identity, and not make them part of your personhood. That's it's reflective of existential there as well. You incorporate all that, and then are able to address these things through committed action, which is the factor that actually makes things accessible to the client, makes these sort of theories available and pragmatically possible. And that, I think, is deeply powerful stuff. So yes, I do expect to use this in the future, hopefully with an integrated practice incorporating many of these types of theories.
I do think that acceptance and commitment therapy can be really valuable to certain types of clients. I think it helps in identifying values, committing to action, as opposed to just getting stuck in venting about things and thinking that we are our thoughts. It helps us take these thoughts and accept them without judgment and understand that they don't have to define us, that we can separate from them. And I think having that ability to unhook from our thoughts can be really empowering for certain types of clients who might be wrapped around the axle of really believing that they are one and the same with their thoughts and feelings. So I also think it's something that is quiet, it is free, it is portable, and it is something that we can help our clients take with them outside of the office to use in their everyday life.